Hi, my name is Dr. Gary Goldstein with the University of Minnesota Veterinary Medical Center Dentistry and Oral Surgery Service. Today, we're going to be describing the proper technique for oral examination and dental charting. Before we do any dental charting or oral examination, it's important to have a cap, protective eyewear, and a mask, and gloves to make sure that you can protect yourself from any bacteria that may aerosolize during the examination. So by doing that, what we're going to do now is show you what we're going to do as an extraoral examination when we're doing an examination on either a dog or a cat. You want to make sure that there's no swelling or draining tracts or masses anywhere on either side of the muzzle and or the lip. Then the next step is to check the mandibular lymph nodes bilaterally to make sure that they are normal in size, they're not increased, and they're not lumpy bumpy. That may indicate some reactive tissue from infection or possibly a tumor. You're going to then look in the, once we've palpated the maxilla, for any signs of swelling or masses or lesions, then we're going to palpate the lower jaw to make sure that that is normal. And what we're looking for here are signs of swelling or enlargement in the mandible. Then the next step is that we're going to look at the gum tissue to make sure that that's nice and pink, as is the case here. We're looking for signs of jaundice or anemia. We want to make sure that there's no ulcerations along the lip surface and the alveolar mucosa or the buccal mucosa. Then we're going to look at the feel of the lips to make sure that there's no swellings or masses along the lips that may indicate a possible tumor, either benign or malignant. Once we've done that, then we're going to look at the hard palate, and we want to make sure that the hard palate is perfectly normal. There's no foreign bodies in there or present stuck between the teeth. There's no masses or tumors. And then we're going to look in the back of the mouth to make sure that there's no signs of any tonsillitis, masses, swellings, or foreign bodies. We are then looking at the tongue, and we want to make sure that the dorsal surface of the tongue is all normal, all the way to the back of the mouth, as well as lingual, to make sure there's no signs of masses or tumors. And then we're going to palpate the tongue to make sure that there's no signs of any oral tumors as well. Once we've done that, now we're going to begin our dental charting. And the first thing that we want to do when we do dental charting is to count the number of teeth that are present. So in this particular case, we're going to look only at the right side. And with the right side, we're going to look at the first incisor, which would be numbered 101, to make sure that everything is normal. As you can see, in this particular case, this upper first premolar is not normal and is fractured. And if you take a closer look at this, you can take the Explorer and you can stick that into the pulp canal. That indicates a complicated crown fracture of 105. So we document that in our medical records. Then what we're going to do is that we're going to check for any type of fractured teeth or missing teeth or diseased teeth or malformed teeth. And in this particular case, this upper right canine tooth is 104. This first premolar is 105, 106, 107, and 108. 109, and then you can see the back, way in the back of the mouth is 110. So all the teeth are present in this upper right quadrant. Then we're going to go to the lower left quadrant, and we're going to count the teeth as well. 1, 2, 3 incisors. 404 is a lower canine. We have the first premolar, second, third, and fourth premolar, even though there's a gap here. And we have the first molar, the second, and third molars. So all the teeth are present. The upper right first premolar, is the only abnormality that we've seen on this side. The first thing that we want to do after then, the next thing we want to do after we've counted the teeth is that we want to check to see how much calculus is present. And we usually talk about the amount of calculus, or the degree of calculus, mild, moderate to severe. So in this particular case, these teeth show a mild amount of calculus present, whereas the back fourth premolar and the molars have moderate amount of calculus. A heavy amount of calculus is when the majority of the teeth are covered almost entirely with calculus. So in this particular case, I would consider this moderate calculus. The next thing is the gingival index and the bleeding. And so you're going to take your periodontal probe and you're going to gently go across the gum tissue to see if there's any type of bleeding. In this particular case, it takes 1 or 2 seconds to see a small amount of bleeding. I would consider that a gingival index of 2. If it takes an extended period of time, 3 to 5 minutes, to get some bleeding on only several teeth, I would consider that gingival index 1. If we probe around, if we take the periodontal probe and we gently go around like this and you get bleeding immediately like this, that would be considered a gingival index bleeding of 3. So when we take the probe around the gum tissue gently and we get immediate bleeding like we see here, that would be gingival index 3. Now what we're going to do is that we're going to do periodontal probing. And so we're going to take our periodontal probe and we're going to probe 3 surfaces on this side of the mouth, on the buccal surface. The canine tooth, you can see now we're going to do the mesiobuccal. We come out, we go back in, the buccal, come out, go back in. And these are all within normal, less than 3 millimeter periodontal probing depths. We're going to do this on every single tooth, 3 surfaces on the buccal surface. 1, 2, 3, and we're going to do that on all these teeth. What you don't want to do is you don't want to take this probe and check for pockets and then scrape that and go down. You want to come out and go back in, come out and go back in. So when we're probing, we're going to do the surfaces, 3 surfaces on the buccal surface like this. 1, 2, 3, and 1, 2, 3. And we're going to do that with all the teeth that are facing us on the buccal surface. Then we're going to do the lingual surfaces on the lower teeth. And what we're going to do with those teeth is we're going to probe the same. So we're going to take this periodontal probe. So the next thing we want to do is probe the lingual surfaces of the other side of the jaw. And we're going to do the same thing. We're going to measure pocket depth in 3 different areas. 1, 2, 3. 1, 2, 3. And we're going to do these probing depths on every single tooth in the mouth. 3 surfaces on the lingual surface and 3 surfaces on the buccal surface. If everything then probes normally, then our next step is to take appropriate radiographs and begin the dental cleaning. So when we do the charting, we're going to look for any missing teeth that may be present, any fractured teeth that may be present. And in this case, you can see that this upper right first premolar has a fracture and the probe can stick in there and it's complicated. So that we need to take dental radiographs and likely surgically extract that tooth. We're going to check for any teeth that are missing. We're going to check for periodontal pockets. We're going to check for mobility. So we're going to take the back end of this probe and we're going to push the teeth back and forth to see if there's any mobility whatsoever in any of the teeth. If there's no mobility, then the next thing is that we're going to check for furcation exposure. So where these 2 roots on multi-rooted teeth diverge, we want to make sure that we get the periodontal probe and try to stick that in between the furcation. If it sticks but doesn't go in at all, but we can see the furcation, that would be considered a furcation 1. In this particular case, these are normal. But if you were to get it in a little bit and you can see and identify the furcation exposure, that would be 1. If you can take this probe and it sticks into the furcation but does not go all the way through, that's a furcation 2. And if it goes all the way through, that would be considered a furcation 3. I'm going to go back to mobility. So when we're checking mobility, we want to use the back end of the periodontal probe and we're going to push it back and forth to see if there's any mobility. In this particular dog, there's no periodontal disease, so there's no signs of mobility. But what we want to do is push that back and forth to see if there's any signs of mobility. What we do in our practice is that if there's a 1 millimeter movement, either back and forth, or mesial-distal or buccolingual, then that's a mobility 1. If it moves 2 millimeters, that's a mobility 2. And if it moves 3 millimeters, that's a mobility 3. We talked about measuring mobility, periodontal probing depth, furcation exposure, and then the last thing we look at is gingival recession. In this particular dog, there's no signs of gingival recession, but where the cementum that is located below the gum line, subgingivally, and the enamel meet, that's considered the cemento-enamel junction. And these gum tissues should be right at that cemento-enamel junction. When there are signs of gum recession, and the gum recession is receded, or there's or below that cemento-enamel junction, then you want to measure in millimeters gingival recession from the cemento-enamel junction, which is about this location, to the bottom of the periodontal. You're going to measure gingival recession by where the cemento-enamel junction is, which is approximately here, and where the gum tissue lies. So if the gum tissue were receded in this particular case, then that would be considered potentially a 3 or 4 millimeter. It's difficult to identify any types of gingival recession in this dog since there's no current signs of gingival recession. But that's the other modality that we're going to identify.